made me late too.
Yeah,
So
your thumb is really funny, I think. We got you yours.
I know.
Mm-hmm.
I know it. And it just flows. You can try to be on time, but
Yeah, sometimes you just can't hit.
you can't.
There's that paper that she asked
Oh.
me to fill out.
Perfect. Well, my name is Devin.
Devin?
Uh-huh.
My son used to go to school with a kid named Devin.
Oh, yeah?
Mm-hmm.
Where at?
In Arlington, Texas.
Oh, boy or girl?
Boy.
That's what I've heard my
Devin.
whole life. I usually walk in and somebody thinks I'm supposed to be a boy.
Devin. Yeah.
Do you have a date of when you're starting radiation?
No.
Not yet? Okay.
We
have an appointment with them
Monday.
Okay. I'm just going to say August.
Yeah.
All right, so this is a card to keep in your wallet. It's got the name of your treatment on there, as well as your doctor's name and when you're going to start radiation. It's an ID card, so if you got to tell your other doctors, like, I'm on chemo, this is my info. Something to keep in your wallet.
Okay.
All right, so the mainstay of your treatment is the radiation, okay? Chemo helps enhance the radiation to work the most effectively, as well as helps kill cancer cells at the same time. So when you're on radiation, you get a smaller dosage of chemo than what you would normally get if you were just on chemo by itself. Does that make sense?
Kind of.
Yeah. Which one is the most destructive on
Chemo.
a person?
Right.
Depends.
I know somebody that's been on chemo and said they didn't want it no more. Then I know somebody been on it and didn't bother them at all.
So that's my point. Chemo is a very broad word used to describe hundreds of different types of medicines.
Yeah.
So everybody's cancer journey is different. Everyone's tumor is different. Everybody's chemo is different.
Right.
How someone responds to the exact same thing can be different.
Right. I understand that.
The radiation can be hard because it depends on where the mass is that they're irradiating.
Mm-hmm.
But if it affects your swallowing at all, that can be hard. So that it's just a different kind of hard. If you start to lose your ability to swallow, you start getting weak, and because you can't get the food in, I mean, that's just a different kind of hard than chemo.
Right.
But that all depends on where they're radiating. Chemo, potential side effects. In all honesty, I think you'll do pretty well because it is lower dose chemo because we are giving it with radiation. Okay. But there are always some potentials that we will talk about. Everything that I say is written down in here. So y'all will have all this stuff to take home.
Now, he told us that the radiation would be 5 to 6 weeks.
Yes.
And he said chemo was once a week, but he didn't say for how long.
Until radiation is over with. So you'll
like
get
once a week for 6 weeks.
So about 6 treatments.
Okay.
Anybody, 6 treatments, if I can stand the 6 treatments.
Yeah.
The chemo, if it ain't bad,
Some things are more accumulative side effect wise. So the more treatments you get, the more you may feel a certain way. Fatigue being one of them. You're going to feel better in the beginning than you are at the end. Okay, that's just the more treatments you get, the more you may be tired, the more your blood counts may start dropping, the more it's usually fatigue and weakness that tends to grow. If you're nauseous, that doesn't usually change. So if you're nauseous after the first treatment, I would expect that to be the story each time. That should not be something that gets worse.
Would that be with chemo or radiation, or it could be either one?
Radiation should make you nauseous.
So we're looking at maybe once a week. Once the treatment stops,
Uh-huh.
how long do the side effects last?
So most people feel their worst about 3 days after treatment. And that's because we give you steroids with your treatment and some pre-medicine, nausea medicine and things IV. And it's when all of those wear off that people feel their worst. Their worst may not be nausea. It may be like, that's the day I just can't get out of bed. Like, I'm exhausted that day. The problem is that a lot of times our chemotherapies are once every 3 weeks. So where you feel bad for a few days and then you've got a couple weeks to bring yourself back up.
Right.
But yours is weekly.
Yeah. Wow.
So it's weekly because we're giving it to you with radiation.
Is that a good thing, bad thing?
No, it's a good
Good
thing.
because I'm not taking either one by itself.
Right. It's a
At
good
a
thing
bigger
because
greater amount.
when we can give you chemo and radiation at the same time, it's the most effective, for one. For two, you're not a stage 4, so we're still trying to cure you. We're trying to make this go away, right? So it may be a little harder just because it is once a week, but it's only 6 treatments, and the goal is to make this go away. So we hit people harder when we're trying to cure people.
Well, and that was one of the questions we had, because in the beginning, when he got the diagnosis, but before the PET scan, okay, Dr. Shea was saying, well, another doctor was saying that they should be able to do like laparoscopic and go in and take that. He was saying, from what I understood, they instead of taking the tumor out, they take out that part of the lung.
Yeah.
So what we're wondering is if, like you said, you're hitting them like really hard because you're basically, from what we understand, targeting 2 areas. One would be the tumor and one would be the lymph nodes.
Right.
So one of the questions I had is, could he go in and have that surgery and have that part taken out and then treat the swollen lymph nodes? Would that make the treatment less aggressive and easier for him to do, or how does that work?
If he did not have any lymph node involvement, then I think surgery would have been a more optimal choice.
Right.
But because there's lymph node involvement, it just makes it to where chemo and radiation is the best choice. You would think that taking it out, like taking the tumor out of your body, would be the best choice, but it doesn't necessarily change things.
Okay. You won't go back, come back.
Okay.
We trying to cure instead of trying to.
We're just trying to see, kind of what all our options are.
You don't want to have a surgery, even though in your mind it may make you feel better to know that it's out of your body. But you don't want to have a surgery that potentially won't change the outcome.
Right.
Okay.
So when you look at the stats and all of the things, chemo and radiation, and then maintenance treatment for a little while after that with immunotherapy, which I'm thinking Dr. S has talked to you about that.
We haven't. I guess that's who we meet with on
Monday.
Oh, Sokotown? No, we've got this much information from him, literally. Because our very first visit with him was the referral. And that's when he ordered the PET scan, and it was denied. And then, he just had surgery on his hematoma on Monday. So he called Monday afternoon. We did a video call. And our video call was less than 5 minutes.
Okay.
So that's why since then I have like a list of like 15 questions.
Okay.
Because like I had to ask him like, what stage is this? How aggressive? It's like,
he didn't volunteer.
I feel like we have to like pump him, ask specific questions to get anything.
And it's already starting off bad. I mean, that's where it's going to be. I'll just go somewhere else.
I mean, he basically told us, which we already knew about the tumor. He said, you got swollen lymph nodes, and we're going to do chemo for once a week, radiation every day or Monday through Friday for 5 to 6 weeks. And that was really basically the extent of the call.
And the video kept coming in and out, going in and out.
Cutting in and out, but
just wasn't not good at all.
Okay. Well, I hope I can answer some of your questions today. So when we treat stage 3 lung cancer, we do the chemo and radiation, and then we do maintenance immunotherapy, and that's for 1 year. But that's different. That's not chemo. It's people tolerate it a whole lot differently, and sometimes there's so much information being thrown at someone in the very beginning of all of this that we don't even really mention this until later, because it's just a lot of info. You go from finding out you have cancer to world turning upside down, and lots of different things being thrown at you in a very short amount of time. So that is the long-term goal is to do the
And
immunotherapy.
how is that gonna affect him in a negative way, like the chemo and radiation?
No, not it's different. So chemotherapy is like, if you imagine your yard, for instance, you've got weeds coming up, and that's the bad stuff. Chemotherapy is like throwing weed killer on your entire yard. The flowers, the pretty stuff, the weeds, we're just chunking weed killer out there. Immunotherapy is like feeding the soil fertilizer.
To build it back? Okay.
The good cells?
Yeah,
Okay.
to replenish and to grow beautiful things from the inside out. Does that make sense?
Yeah.
But we don't want to go that cancer back.
No, it's to help your own immune system fight off things and to.
Is there anything we need to do beforehand to try and build up his immune system, like elderberry or does all that? No.
There's nothing that you can do to try to build up your immune system. Your immune system should be fine. I will say that the number one side effect of chemotherapy is weakening of the immune system. If you haven't gotten your COVID vaccine, we do really encourage that for the patients and the family members of the patient. If by chance you were to get COVID, which you dang near you're exposed if you go anywhere right now, if you were to get COVID while on treatment, that will do nothing but 1, make you sick, and 2, delay your treatment for a while.
Well, what about a change in diet?
I mean, yes and no. So,
can I have sugar or can I? One guy told me sugar cancer is like a Corvette. You give it sugar, it takes off.
You know,
is that true?
I think that if eliminating sugar from the diet is what cured cancer, it probably would have been cured a long time ago.
That's true.
You know,
Yeah.
I think that we encourage a well-balanced, healthy diet, increase in protein, increase in fruits and vegetables, just what we know to be healthy for us. But if you're nauseous or if certain things turn you off in regards to food, and all you can stomach is chocolate cake, then I want you to eat the chocolate cake because I need you to have calorie. So chemo and radiation is not the best diet plan. I would not try to lose a lot of weight on chemo and radiation. Just because you need it right now. It's not, now is not the time to
go on a diet.
Change, So increase protein, eat what you feel like eating. Your taste buds are going to change. Your some things are going to taste good, some things are going to taste terrible. A lot of people talk about the nausea with chemotherapy similar to morning sickness and pregnancy, where it's like the smells and the textures, and if you cook that chicken near me, I'm going to go throw up. You know, so you can get waves of nausea based off of senses and taste of things. And so if you can't eat it, you can't eat it. But you got to find something you can eat, like whether you're supplementing with protein shakes or eating whatever you can. You got to eat to live. We know that. That's common sense, right? So I do want you to drink a whole lot of water. By a lot, I mean like a gallon.
We got alkaline water. We got all types of water.
I don't care what kind of water you drink. I just want you to drink a bunch of water.
I was going to ask that now, but
that will help flush all this stuff out.
Okay.
I'm sorry. One of the things we've heard about different people having the blisters in the mouth. Is that, could he get that with what he's getting, or is that people that are having?
It's anybody.
It's anybody.
So chemo is excreted through secretions, mostly our urine, but also spit, semen, tears. I mean, so basically any mucous membrane can be affected. But so there's a rinse of 1/4 teaspoon of baking soda, salt water rinse. It's all in there.
The magic mouthwash stuff.
The magic mouthwash we give as a prescription if you get a sore, if you have pain. It's got lidocaine and different stuff in there. But to help prevent the sores, we recommend the baking soda salt water.
That's what I wanted to try and do something beforehand. Like I was even kind of looking at like oil pulling,
Like
with the coconut oil. So I just,
I
don't want to wait
that.
till he gets the blisters to, if we can try
Right.
to help lessen it or prevent it or something. I know that we can't prevent it, but.
So mix up some baking soda, salt water, put it somewhere you go frequently, the bathroom, put it by the sink, and every time you pass by, swish and spit for a little bit. I can't promise that it will keep you from having it, but it should help minimize that. And then if you get a sore, let us know, because there's medical mouthwash we can call in.
Okay.
So I'm going to call in some nausea medicine for you to have on hand if you need it. You may need it. You may not need it.
Okay.
You will lose your hair with this treatment.
Oh, shit.
I'm sorry.
Might come back better.
Hey,
I knew a girl
You
that
never
had blonde straight hair and hers come back brown and curly.
You never know.
oh,
Never know.
Lord, here we go.
Maybe you'll come back blonde.
I got it.
Blonde don't look
One is red-headed. One look like red-headed. Other one look like me. So.
Okay. What's the success rate of this treatment?
Different for each person. I would have to get on the computer and
They say
get
the
all the
kind that
stats.
I have, squamous,
Yeah,
small cell. That says it's
You've got non-small cell. You don't want small cell.
Yeah, I got non-small cell, and they say it's not difficult to treat. I mean,
No, it's not difficult to treat.
it ain't one of them hard.
I can pull up the exact numbers. I don't quote the numbers.
Yeah,
I can't remember them.
Yeah. What made you dedicate yourself to cancer?
My grandmother died when I was 6 from she was 48. And she had a doctor here, Dr. Duncan, who was here until just a couple years ago. And I just always knew about him. He, even though my grandmother didn't live, she was far gone before they found it. But he made a really big impact on my family's life, and just the way he cared for her at the end, and that's just kind of how I like it as well.
Now, will y'all do the whole entire 6 weeks of treatments before? I mean, I'm assuming, do y'all go back and do a PET scan after that to see, or do y'all test before that, in between, or how does that work?
We will scan probably 6 weeks after you're done with radiation, and that will come from the radiation doctors.
Okay.
You don't want to scan too early, because radiation continues to work even once you're done with it. And it can also make things look worse before it makes them look better, because it's a sunburn from the inside out, and it can cause inflammation. And so you want to let all that calm down before you start scanning. Let's see here. Some numbers.
I'll never forget that name, Devin. That was a little mischievous joke. It's a red freckle face Devin. He was a good kid. Turned out to be a good kid.
Let's see, I'm trying to find your answers, but there's a lot of stuff in here.
Oh, I forgot what I asked you.
I just was curious what the success rate is.
Oh, success rate. Oh, I'm not a big numbers person.
So this says there's a 7-fold increase in the control of the tumors in regards to 5-year progression-free survival. That's what we look at. We don't look at the success in 6 months from now. We look at where you're standing in 5 years from now. So
I got another question for you. If I don't do nothing, how long do you think I'll last?
a year probably,
A year?
maybe.
Golly.
Maybe.
So 3 It's really running up Forward's door, isn't it? I mean, it's not spreading, but
A 3 means that you
Where it hasn't spread yet.
it's not spread,
mhm,
but it is in your lymph nodes.
yeah,
So that's why it's important that we start treatment as soon as possible.
Yeah.
And that's why you'll get immunotherapy, but we'll talk about that later.
I mean, what the
So that's something he'll start after treatment for, how often is that? You said it's over a year
That one's
period, right?
every 2 weeks
oh,
Okay,
for 1
so like
year.
some kind of IV something. Now, is he gonna have like a port or something for all this stuff? I mean, how is this stuff gonna be administered? Is he gonna have to be
IV.
poked every day?
No, IV.
So he's gonna have to get an IV every day, 5 days a week?
No. Radiation doesn't do needles.
Okay, how
It's
is
just
that?
for the chemo.
oh,
Radiation is a machine.
Okay,
oh,
They'll stimulate you. They give you a little tattoo. It's like a dot. It looks like a pin mark. And that is when they come up with the plan of because they'll outline your tumor from all angles. They'll get physics involved, dosimetry involved, so that they know that they're only radiating what they are supposed to radiate.
mhm,
That's a mathematical, scientific plan that only they do. And then once the plan is there, you just lay on a table. So the needles are from us, and that's when you get chemo. You'll get an IV.
how long do the chemo treatments last, like per session?
You'll be here about 4 hours.
Dang, 4 hours?
Now,
Yeah.
how does that work on the days that he has radiation? I mean, are they gonna be able to schedule them where, because we live like almost an hour from here.
They'll tag team. So
So,
like you can be hooked up to chemo, and they'll come get you for your radiation.
Oh, so he can just be doing to it, okay.
Yeah.
So one time a week we'll be here for 4 hours.
Yeah, but, oh, okay, because that radiation, I get that one time a week?
No, 5
Radiation's
days a
every
week.
day.
Radiation
Monday
Friday.
through Friday,
Okay, and then chemo, I get that
one time a week.
one time a week, right? Okay, okay,
Mm-hmm.
that's good. You make me feel a lot better now. This doctor just be.
Doctors, they're really busy.
Yeah, and they have other patients more than you know. So I didn't look at it that way either. So
It's just a crazy time around here.
yeah,
Okay, so numbness and tingling in the hands and feet. People can experience neuropathy
I
with
heard about that.
with this
That's
chemo.
what
That's usually an accumulative side effect, something you may not notice in the beginning, but after cycle number 6, you'll probably feel like, I kind of feel something there.
Mhm.
I've not seen anyone have terrible problems with the neuropathy, only getting 6 treatments.
Mhm.
So that's usually people on it for a long time.
Is that something that y'all could address? I mean, would you get like pain management for
We-
that, or what is?
Okay. I mean, if it's really bothering you, we give pain
Okay.
medicine for it. It's just a Band-Aid. It's not anything that
Yeah.
we can make go away. Being off of chemo makes it get better.
Mhm.
So diarrhea and or constipation, everyone's bowels are different. We'd rather you be a little loose than backed up.
Yeah.
So if you need to take anything over the counter, Imodium, stool softeners, laxatives, all that's fine.
Okay.
Muscle and joint pain, ibuprofen works the best for this if you're able to take that.
Okay.
800 milligrams every 8 hours. If you're hurting, we don't want you hurting. So if you're hurting, tell us so we can treat that appropriately.
Okay.
You could be allergic to the medicine. You've not ever had it before. One of the medicines, the Taxol that we give, is kind of like the penicillin of our world, meaning that there are a fair amount of people that are allergic to it, and we don't know that until we give it to you.
Yeah.
So
Damn.
you should feel your normal self getting the treatment. The way you come in should be the way that you leave. You don't get sick back in the chemo room, or most people don't. So if you feel any kind of weird, the room's spinning, my chest hurts, my heart's racing, just anything different, you need to tell the chemo nurses, and they're going to come at you like a SWAT team.
Okay.
Okay? We talked about the water. That's to flush out our kidneys and our liver. You know, the chemo and radiation working together are very dehydrating. You've got chemo killing both good and bad cells. You've got radiation burning cells, and your body's in like this overdrive mode of trying to repair itself nonstop. And that sucks your water dry, okay? So if you allow yourself to get dehydrated, you will feel terrible, okay? So drink all the water. We want to see people here to try to keep people out of the hospital, but if you've got COVID-like symptoms, there's nothing we can do about that. Can't let anybody who could possibly be COVID in the building if we can help it. If you get vaccinated, that does change things a little bit, that we can ask you if you're vaccinated and then allow you in the building, depending. So if you have chest pain, if you cannot breathe, those are true emergencies. Don't come here first. Okay, because we'll just send you somewhere else too. But if you don't feel well, we want you to call us first. Okay, before going to an urgent care. And right now, the ERs and the urgent cares are cesspools for COVID, so I wouldn't go there for literally any reason.
I stay at the house.
So let me call in your medicines.
Do you have it at Powers Pharmacy?
I can send it to Powers.
Yeah.
Okay, so you're gonna get 3 different medicines. One is a steroid that the way you take it is 20 milligrams, which is 5 tablets, 12 hours before your infusion and 6 hours before your infusion. That's once a week.
So that's before the chemo.
Before the chemo.
Okay.
Okay, so and that's to help prevent infusion reaction, allergy reaction, and also helps with nausea. So, and that's written down on the prescription. Powers. Then I'm going to give you Phenergan and Zofran because those are good for nausea.
Okay.
If you need it, take it. If you don't need it, don't take it.
Okay.
But you'll have it just in case. They're good to alternate as well. So kind of how you alternate Tylenol and ibuprofen when somebody has a fever. That's how I would alternate the nausea medicine if it's just not working real well, taking one of them. So that's 3 prescriptions sent. Your blood pressure medicine, we'll watch that as we go. There are times we take people off their blood pressure medicine because their intake typically changes when they're on treatment. They're not eating as much. Their pressure may drop, which will make them dizzy and not feel well. So that's something I want you to watch at home, and we'll also watch it here, and we'll address it if we need to. The pain medicine that you're on, is that a long term? You've always had hydrocodone?
No, I was in a real bad wreck. And I had this shoulder done. I got this hematoma, and my doctor gave it to me, you know.
Okay.
And plus I had a cracked sternum. So,
okay.
Yeah.
So finish utilizing what you have. If you need refills of your pain medicine, I think Dr. Sokatanu had y'all sign a pain contract and all of the paperwork. It's usually in the new packet paperwork. I just saw your picture.
My picture?
Was he making a face? Probably.
I love it. That is so funny.
So would that have been like on our first visit then when we came to the consult?
I didn't see no paperwork like that.
I mean, I remember that's been like almost 2 months ago or something. I don't know.
Can you re-put that out, please?
I'm seeing it. You did sign one on June 7th.
Can you put that out for me, please?
So basically, if you need refills of your pain medicine, we'll take care of those. And the rule is you can't get them from anywhere else.
Right, yeah.
So we'll go over that if you need more refills. They print out so much stuff that's not needed. We have a program called the Health Tracker Schedule where we can send you a text message saying basically how are you doing, and if you say great, that's good. If you say not good, it sends a message to our triage nurses to call and check on you.
That's good.
So it's an extra attempt to keep people out of the hospital.
Yeah.
Do you want to be a part of that?
Yeah, that's fine.
What's your zip code?
75563.
And your cell phone has internet?
Yeah.
Okay, what's your number?
972
Okay.
464 6308.
Okay. This is just like what the health tracker is, and then also what it'll look like on your side of the phone.
Okay.
Okay, so we cannot schedule you for chemo until you have a date to start radiation.
Yeah.
They have to start at the same time.
Yeah.
So you're meeting radiation on Monday.
Yeah.
So when you finally get a date to start radiation, that is when I need you to call our schedulers and tell them that you need to be scheduled for your chemo.
Call radiation. Call the chemo department.
Like we're two different worlds.
There,
We're all under
I
one
see.
building, but we are two different worlds. We've got different scheduling systems. Don't consider us the same because we're not.
So this is
We're-
chemo here.
We're the chemo side.
And where is his side at? On the other side of the
Yeah,
building?
when you come into our main lobby, we're all on the left side, and then they're all on the right side.
Where you went for the PET scan the other
We're all back down by radiology. Okay,
Yeah.
they down that way. Okay.
Yeah, so we've
Okay.
got two different systems. We are not the same.
Okay.
So you'll get your appointment with them first,
Yeah.
and then I need y'all to call so that we can get you scheduled for chemo.
Well, I'll just stop back over here when I leave.
And that's fine too.
Okay.
That's fine too.
All right.
Okay, did I answer y'all's questions?
So far, yeah.
Do you
What
think
is
of
this
it?
here?
This is your consent. We can't schedule you for chemo until you've consented. The other is just junk paperwork that they filled out or that they printed.
Account number.
That's your medical record number that we have. You realize nobody ever reads those?
Why? They
I think you're the first person that's actually read that.
My condition has been explained to me as non-small cell lung cancer, right?
Mhm.
I'm about to request Dr.
I was gonna rent when we were first getting married, and I had went and found this place and was gonna rent, like to have the
Mhm.
ceremony and stuff. That guy got mad at me because I sat there and wanted to read the contract. He's like, "You gonna read that?" I said, "Yeah, I'm gonna read it."
I don't think anybody's ever read this.
So where you want me to sign, the patient or
That
legal?
top line, and I'll fill out the rest of it.
Six treatments. That gonna be some hard ass treatment.
Nah, you're gonna do fine.
You're
You're gonna do fine.
gonna lose my locks.
Yeah, you are gonna lose your locks.
Oh Lord. I'm being like Steve Harvey.
That's gonna be the worst thing for him. You know what? Losing his hand.
It's hard. It's an emotional